And I'm going to hand it over to my colleague, Trisha Parker, who's going to be talking and doing a little bit more of a deeper dive and more specific data related to Sacramento County. Trisha?
Thank you, Andrew. Good afternoon, everyone. I'm going to be giving a brief overview of our substance use treatment for youth and kind of just going over the services and how we are treating opioid use disorder. So just kind of looking at our continuum of care for youth, we have our prevention services. These services really target all of our youth in our community. They really look at educating. They're in many of our schools in the community. They do a great job with marketing and media to really combat the marketing and media that is targeted to appealing to the youth for substances. So they're really there to educate on the risk of substance use and kind of bring awareness to combat kind of the attractiveness of substance use. For those youth that qualify for treatment, we have a variety of services, starting with detox and withdrawal management. For these intense services, they are provided in the ERs with more of a medical management for them. And then we have residential. Here in Sacramento County, we do not have a youth residential substance use facility. However, there are many pieces of the puzzle, and we have about 3/4 of that puzzle put together to start our own residential here in Sacramento County. So that is exciting and more information to come in the future. We also provide outpatient services and intensive outpatient services. This depends on the hours per week that the youth is delivered services and what their needs, their specific needs are. Also, youth that have a opioid use disorder diagnoses can be offered medication-assisted treatment. And I'll kind of go over more of that in the next few slides. So again, for youth to meet treatment here in our substance use department, they need to have a DSM diagnosis. So an example is opioid use disorder. Many youth that have an opioid use disorder, like Andrew talked about, have polysubstance. So they often come with another diagnosis of marijuana use disorder or alcohol use disorder, which are two of the prevalent substance use that we treat here in Sacramento County. So our youth treatment providers are here. We have Another Choice, Another Chance, STARS Behavioral Health, also known as Capital Star, and they are also a TAY provider. They will provide services for individuals through the age of 26. We have WellSpace Health, Sobriety Brings a Change, and coming soon is Stanford Sierra Youth and Families. So we gathered a small sample on what are the youth saying, what are the providers saying out there in the community. And we do have our providers reporting an increase in opioid use from the referred youth. Also, they are reporting that youth are seeking out Percocet, knowing that fentanyl is laced or can be potentially laced with fentanyl. In addition, they are recently reporting that youth are actually seeking out fentanyl. It's much cheaper. It can be easier to access in many ways, and that is something that they're seeking. It's often reported that there's more of a euphoria with that and a risk that they want to take. And our CPS partners are reporting excessive use with the CSEC youth. Also, they are reporting with these youth that many of their friends, if they don't have Narcan on hand, if they do, they'll utilize that, but they will often use ice and other means to revive that individual. So it's almost like an awareness of the risk and their use of wanting that benefit and disregarding those risks. So a little scary to hear. So when we have youth that come in for treatment services, really what we're looking to do is a lot of behavioral techniques and interventions, which utilize evidence-based principles. Also, if there is an opioid use disorder, again, they have the option of MAT services for youth. Narcan distribution is something that we provide to the providers, an application. So our providers can complete the application and access Narcan for individuals in need. Also, we're working on early referral to treatment to really catch the youth early in their substance use. And a little bit more about MAT. So for those that are minors, there is a increased qualification for MAT. And the youth does need to have 2 failed treatment attempts to qualify for MAT. And then also 2 documented unsuccessful attempts at short-term detox. So there's a little more strict qualifications for it, but it is something that is available for the youth in our treatment services.